had a great podcast interview today with Amy the Punisher. That's going to come out in a couple weeks. And one of the things that we were talking about was access to care and understanding and unpacking physical therapy in the States. So there's this argument in my profession, and a lot of people are pointing to overseas, they automatically get postpartum care. Physical therapy isn't covered in the States by insurances. It's only out of network. There's a lot of inaccuracies there. Some of this is just paying attention to colleagues overseas and understanding really what access is there and what access is here, and unpacking who's making the decisions. Okay. All right. So let's just say we're talking you need care. Okay, so let's just take insurance off the table, because it really shouldn't be there as far as making decisions anyway. I firmly believe, and this is something I was talking about with Amy, not only in postpartum care, but in injury, like physical therapy in general, there's going to be 3 separate categories, okay? You're going to have a third of people that they can kind of do whatever. They can do therapy. They don't have to do therapy. Like, they're just fine. Then you're going to have a third of the people that general care, so a entry-level PT, a very basic PT, basic insurance-based PT, if we want to put it in that category, just generalized, that third, doesn't matter, they're going to do fine. Okay, and then there's this whole other third that they really do need individualized care, an individualized plan, somebody to actually sit down because it's complex to walk through. And that's where there's kind of this next level of care that really needs to occur. And that's why it's been challenging for me to hop on the everybody needs physical therapy train. Keep in mind that I am a huge advocate for my national association. Keep in mind I was formerly president of the Academy of Public Health Physical Therapy. Like, I will wave that flag all day long. That said, I think we have to acknowledge that, not every single person who gets injured needs rehab. Not every single person who has a baby necessarily needs the highest level of care. We might need to just have some better screening and asking questions so we can figure out what bucket to put them in. Do we put you in the bucket of, you're just fine, we don't need to worry about it? Do we put you in the middle bucket where I can send you wherever it frankly doesn't matter? Or are you in the bucket where, gosh, if you do the first 2 things, you're not going to get anywhere. You need to go past go and go right to that third bucket where, you need somebody to dive into this because it's complex. It's not going to respond to nothing, and it's not going to respond to basic entry level of care. And I think, it gets confusing because you would assume that therapy is therapy, right? Well, think about the job that you do, understanding that you're all doing very different jobs. I'm sure there's some people at your work that they get by. They do the bare minimum, they get by, they do their job. And then there's some people that don't do a great job, and then there's some people that do a kick-ass job at like really tough stuff. And if you've got a problem, that's like your person to go to. It's the same thing. Okay, so now let's kind of pull the insurance bucket into all of this. Okay, so what do most people do? Do most people seek out postpartum physical therapy? No, they don't. And if they do, what's the first question? Do they accept my insurance, right? When really the first question, we need to back up a step before we even get into insurance. It's like, what bucket do you fall in? Do you fall in the bucket that really, no matter what you do, you're going to be fine? Or, basic level of care, you're going to be fine? Or, we need to go next level and get you much to that point where that person's really going to dive in. This is complex. You need a higher level of expertise addressing this. That's really the first question. But what happens is people, they enter the funnel, they go to their doctor, the doctor says, oh, okay, fine, go to therapy, it won't work. Because maybe their experience is it doesn't work because maybe they had these higher level of clients that got dumped in the wrong bucket. So most of the time that PT doesn't work is because the bucket that they got put in wasn't the right one. And unfortunately, a lot of these, and this is what Amy and I were talking about, a lot of these practices that are far more productivity oriented, they're focused on revenue generation and, churning out as many visits as possible, negotiating contracts with insurance companies, and you don't know what those rates are. And usually they barely pay you enough to keep the lights on, much less pay your staff. Those places, because the focus is on productivity, they're going to want you to do that basic stuff, and that basic stuff is fine, okay? And you might have a few people sprinkled in. I'm not saying all of these base, clinics are bad. But that said, a lot of us who got out and a lot of us who do not work in insurance-based setting is because 95% of the people that I see, they've been somewhere else first and they didn't get their questions answered. So they got put in the wrong bucket first. And to me, it doesn't make sense because they never should have put in that basic technical bucket first, because that was never going to work in the first place. So really the problem isn't that PT doesn't work and only a few people and only that type of therapy is out of network. No. We need to be better about triaging up front. And that's where, as a provider, it's just me and my practice. There's only so many hours in the day. And that's why I think that it's so incredibly important to put out far more resources to answer those basic questions for the first two buckets, because I don't feel like, working with complex cases, I don't feel like my skills are necessarily needed for baseline stuff, but that's not to say I don't have that information to share. And also geographically, not everybody lives in this area. And so for me, I grew up in a pretty rural area in upstate New York. It was 70 miles to the first major hospital, about, over a half hour to the closest Wegmans, if anybody's keeping track there. There wasn't a possibility for me to do regular visits or, if I ever wanted to do that. And so that's why I think it's so incredibly important to put out good information here on social media, provide opportunities, free screening. All the stuff that I put out is to make sure that those buckets are addressed, okay? So that no matter what's going to happen, you at least have some good information, and if it works, beautiful. But also to understand and to figure out early on if this basic stuff isn't going to work, because you blow 6 months doing basic stuff and then everybody's just holding up their hands and oh, we don't know what's wrong. I guess that's too bad. Sorry for you. Then that brings about this whole other level of, oh my God, am I really messed up? Am I really broken? When the fact of the matter may be that you might have been put in the wrong bucket. You were placed in front of a technician when really you needed to be with somebody that was functioning far more at an expert level. And I know if you're a PT, if I pissed you off by saying that, ask yourself why you're upset. We should be functioning at a high level for all our clients. And how did this get driven? This got driven by insurance, dictating payment, dictating, authorization, all that other crap. That's a whole nother thing that I'd rather not get down. But what my point is this: as patients, we need to be aware that there's different levels of care. And if you're trying to DIY this, okay, and you do just fine, and you find resources, stuff that I put out or stuff that other people put out, and you're doing just fine, perfect. You're in that first third, okay? Let's say you try and do that, and okay, I need a little bit of help. You go in, you do that basic entry level, you go, to the clinic down the street or the hospital base or something like that, and you do just fine. Great, check that box. Glad it worked out for you. But in the case that you might be in that third bucket, okay, you try to DIY it, or you tried to do that baseline and it didn't work, please do not blame yourself. We are not doing a great job at triaging our clients in advance. We are not doing a good job as a medical profession to look and find predictable patterns and say, gosh, you know what? In 2 or 3 visits, you're not progressing the way that you should be. We need to get you to somebody who can dive into this a little bit deeper. And I think, unfortunately, lots of times it can take people years to get to the right bucket when really we should be identifying this sooner. And how do we do that? We look at past history, we look at past medical history, any predictive factors. Yes, we look at the birth, but we also look at current symptoms, okay? And then make sure that what we're doing matches kind of what the needs are of that person. So this all goes to say, please don't blame yourself if you're not getting better, because it's not you. The last thing we need is to be guilting more moms. What we need to do is say to the medical profession, and this is like anybody who works with postpartum women, we've got to step up. If somebody's not getting better and you don't have the capabilities to do that, you need to know somebody who does, okay? And also remember that you're still doing a really good job. There's so many women to help right now, it's not even funny. So being able to identify where your strengths are and where you might need to have resources to step up if you're not going to do that, and that's fine. But that's where I think sharing our work with people that, you know, have skill sets in that area, postpartum coaches and trainers, if that's not your wheelhouse and that's what that person needs, be sure to refer out for that. Other support services where if that's not your wheelhouse and that's what they need, we need to kind of delegate that stuff sooner. So tell me what you think about that. Like if you're a mom and you're watching this, or you know, you're not a mom, you're just watching it anyway, like have you ever gone in and you did everything you were supposed to do and you didn't get better? Like where'd the blame go? Did it go on you? Or was it like, you know what, I'm not the person for you, let me refer up? And then how many of you actually like went down that pathway and found somebody that was able to answer those questions for you? And then for those of you that are postpartum pros, like where's your wheelhouse? Are you in the middle bucket where you're like, yeah, I can turn it out and basic outcomes, I'm good to go, and we need that? Or are you like, yeah, I want to go next level and I want to work with these complex cases? And again, we don't need everybody in both places. We just need to triage a little bit better. Tell me what your thoughts are. I'd love to see you in the DMs.